Hi, I'm Lisa Garr, host of The Aware Show, and I'm very, very excited about today's show because we're talking about something that is so revolutionary and so cutting edge and so extremely effective that I feel the need to want to stand behind and really explain to you what it is that we're talking about today. We're talking about the light therapy revolution. And this is something that is very well documented, very well researched, and we're bringing this information to you today because it's easier when we compile it all in one place for you than to be able to go forward and do your own research. None of the statements that we're saying today are evaluated or have been evaluated by the FDA. They are subject to personal experience. However, I encourage you to listen to your own truth. Take what we're talking about today and use it at your own discretion, but really do the research. Dive in, find out what's available on this particular topic, which is what's so exciting. Because when you search on Google about in light or light therapy specifically, you'll get studies that are done by the Mayo Clinic and done by various very well established universities and establishments that are documenting the health benefits of light therapy. Now, I have personally had such an incredible experience with it that I wanted to bring it to you, and I don't endorse products. I have done for 15 years a very journalistic radio show where I don't stand behind and endorse products because I have spent these 15 years developing trust with my audience. I talk about various products and I use various products all the time, and I help other people promote other products, but rarely do I stand behind one this much to actually say this worked incredibly effectively for me. And I'm excited. I'm purely excited to talk with you about it. And joining me is the expert in light therapy, Wes Burwell. He is really one of the foremost experts in light therapy because he has done the research. He has researched the PubMed studies. He is prepared now to talk about this. He uses this in his own chiropractic practice and has also counseled people, thousands and thousands of people worldwide who use light therapy. And so he speaks from his own experience as well. And he is joining us today. Welcome to the show, Wes. Thanks for being here.
Well, thank you for having me, Lisa. It's a pleasure.
Yes, I'm excited about this. So first of all, if we could, what is behind me here is the specific light therapy that we're talking about. Can you explain to people what these are?
Well, in the background behind you, we have different style pads. You can see on your right, it's a large pad called body pad, and then they've got on the other side, you've got a smaller version, which we call a pain buster one, to 90 diodes. These are a combination of red and infrared, and you also see that on the pad, which is on your farthest left. And then we also have different versions which also attain other colors, which are your blue and infrared, which is the middle pad. And the new addition that we've just recently, or that the company has added, is a tricolor pad, which is a combination of blue, red, and infrared.
Well, doesn't the blue and the red create a different? How does that create a different frequency? Well, let's back up by talking about what specifically do the red lights do in terms of a therapy.
Well, the different colors are designed just because of their basic absorption by the human body. Your infrared penetrates probably the deepest, goes from 20 to 100 millimeters, whereas your red, it's more for surface, where you're going into the skin as well as into the soft tissue, muscles, things such as that. So any type of issue going on there, this is where it will help support the biochemistry to be able to bring something back to balance in the case of an injury or what have you. Wound healing, things like that. The blue light is highly absorbed in the first 3 to 4 millimeters of the tissue. So anything that's a surface issue, this is where the blue light really shines, no pun intended. So
for skin issues and situations having to do with the skin, right?
Correct. Yes.
So this could be psoriasis, eczema, wounds, cuts, lacerations. Can you talk a little bit about the benefits of the blue light on wound care?
Well, blue light actually, there's research showing the fact that using blue light directly over something like a MRSA infection, studies have shown if it's the proper wavelength of blue, it can actually eradicate a MRSA infection, which of course is pretty much a bacterial infection which is antibiotic resistant in most cases. So it's a definite option to be able to utilize the color of blue on this bacteria to shut down the infection and then allow the medication to functionally work even better.
Great. Well, we did a show and several shows where you actually displayed and offered a wonderful information product which includes 15, 16 videos on the topic, and then we had thousands of people that are interested in this, and we took the top 10 most frequently asked questions and we decided to address them on a show so that people could really get their questions answered as a jumping off point for people. So in these pads that are located behind me, how is it that laying these pads on various parts of the body, and I have an example of one of them here, and this is one that you can put under your chin like this, which is great for TMJ, and this is one of the things that I originally used it for, was healing TMJ. Oh, this is actually the light pad, sorry. There's another one that I used for TMJ. So it looks exactly like this though. How does this work?
Well, as this, with light therapy, it's all photochemistry. So it's actually passing through the skin and penetrating to the tissues, and the body pretty much is absorbing that, and then it's creating different chemical actions, such as releasing nitric oxide, as well as increasing ATP, which are the two primary fundamental pieces with light therapy. So in doing so, we're increasing, getting vasodilation occurring based on the nitric oxide production and release, so that now you've got better blood flow. Because when you're stressed, you'll be contracting. In a lot of cases, the muscles in the jaw, the pterygoid muscles, will be severely contracted. And of course, as this continues, this is when TMJ can pretty much show up. So by relaxing and releasing those and bringing in new blood supply and allowing it to drain, this is thereby how it's helping to support the body, as well as increasing the cellular energy to help it to detoxify and clear out.
So I write in my book, Becoming Aware, I have a new book out, and I document in the beginning of the book all about a very traumatic brain injury that I had 15 years ago. And at the time, there was nowhere near the research or knowledge that we have now about how to heal and what to do with traumatic brain injuries. Most people even have, concussions, major and minor concussions, and they don't even remember that they have them. And they take several days to recover and then go on as if life is the same, but it's not. The swelling in the brain and the confusion and the, in my sense, I had lack of memory, language loss. There were so many horrible effects that I went through. But many people suffering from TBIs, traumatic brain injuries, and concussions do not know what to do. They wind up confused, their memory is lapsed, they are very slow to react, multitasking is not an option, eyesight is affected, headaches, all sorts of things, not to mention balance problems, which then leads to seclusion, anxiety, depression. It's very underdiagnosed. And so in my book, I talk about what I did to heal my brain about 15 years ago, which was using EEG and neurofeedback. Well, one of the things that it did enormously help my brain, which was incredible, but it didn't help the TMJ. And as being a doctor of chiropractic, anyone who has had a bump on the head or a concussion of any kind is automatically predisposed to TMJ. So now you have one bump, you usually have two because your balance is so far off. And it just gets worse over time, and I have gone through several night guards. I mean, 200, 300, 400 pounds of pressure on my jaw at night. And the first time I tried that, the pad that goes underneath and really gets to those jaw points. Now, one of my favorite things is the deep tissue massage here. If anybody just puts their fingers in those points there underneath their jaw where the muscles attach, you'll feel a certain amount of pain. You couldn't even touch this on me before, and it felt like this desk. The first time I tried that, I had a total melting of those muscles where it felt like I had just had an hour deep tissue massage. and that night slept with my mouth open for the first time in I don't know how long. Usually I sleep like it's not good, but it's, tell me a little bit about the results of TBI and jaw issues really quickly.
My background is actually in biofeedback, not in chiropractic.
Oh, thank you.
But I've seen and worked with numerous people with traumatic brain injuries, as well as PTSD, different things such as this. And one of the things that I've noticed over and over and over again is whenever anything happens physiologically and or even excess emotionally to people, the clenching really starts here, and the muscles will fire even if the teeth aren't clenching. So when the person falls asleep, this is a lot of cases where the body tries to dial out the stress by having the facial muscles will contract by themselves to pull back to get the molars to touch independently and get the front teeth from stopping touching. From Chinese medicine, this is turning on the switches, in essence, the meridian system, to engage a point of relaxation, because the back molars participate more relative to engaging the parasympathetic nervous system, whereas the front teeth engaging or activating your sympathetic. So the body knows how to fix the problem, but unfortunately, due to nutritional deficiencies, which were cited from Pottinger's work and Weston Price's work, showing how our skulls have narrowed, the lower mandible is shortened, the mandible can get trapped and will contract, pull back, and once it relaxes, then the jaw moves forward and the front teeth engage, and so the jaw does this all night long. And of course, that constant excessive contracting and as well as clenching is creating a reduction of blood flow through the jaw in and of itself, but it can also even create somewhat of a back pressure effect to blood flow to the brain. So a lot of cases you'll wake up with headache, a sore face, what have you, and the lymph nodes underneath the jaw, which are at the base where the smile lines are, and at the base angle of the jaw here, they will actually start to get somewhat clogged up because the contracted muscles are not allowing proper drainage. And this backs up the head, what can also directly affect into the chest. So by putting the pads on, we're actually opening up a lot of the drainage points for the pretty much the metabolic waste, things like that, to be drained out of the head and allow new blood flow to come in, which of course is also definitely helping the whole system to relax. Because your brain's the administration center neurologically. So if it's having a deficiency of oxygen, well, and of course, it will also be affected in some form.
Interesting. So I use this, specifically we just put it on our couch, and we just have it set up there. And so we are, between myself and my husband and my daughter, we have probably once or twice a day we're on this machine, and it lasts for 20 minutes. It'll shut off in a second, and then I'll put it back on. And there's various frequencies that you can set it at. But I specifically used it to start off with the TMJ, and I had such a great result that then I went forward and started using it on an old injury that I had 2-3 years ago. I tore my right hip flexor. And it's the muscle that attaches right to underneath the hip bone. And it's a tough one to get to with chiropractic and massage. And it's, I tried cold laser for a while, really didn't work, other than temporarily, but I just couldn't get to an office every single day and go through a whole treatment in order to, it just wasn't working in my schedule to spend an hour a day going to the chiropractor's office. So you had mentioned that it works on slight tears, muscle tears, and so forth. Can you explain how that would work?
Well, with it releasing the nitric oxide, I call nitric oxide kind of the precursor to activate all healing within the system, because it's promoting things like angiogenesis, where it'll actually start to build new blood vessels to supply the area, getting better perfusion, more oxygen and blood flow into an area, as well as drainage. And so with a light pad system, you're able to give an exponential release of the nitric oxide as well as the ATP production wherever you're placing it. And using dual wavelengths such as the infrared and red, we can get much deeper penetration all the way through the tissue matrix. And the red, of course, is addressing the surface up to 8 to 10 millimeters into the tissue. So you're getting this to benefit neurons and things such as near infrared.
Now, you said using a three-patch system. Is that what you said?
Well, for the most part, just using the two different wavelengths, like using the red and infrared, you'll get the level of penetration that you're looking for. But like I said, you could even have used a tricolor pad where it's addressing all, with all three wavelengths, you're still addressing the same thing because the quotient of near infrared is exactly the same.
Okay, so behind me, what you're seeing is a 6-pad system. What's the difference between the 3-pad system and the 6-pad system, and how will people know what would work best for them?
Well, primarily, it's the more pads you have, the shorter that you can make the session, because you're going to be donating light to the person's body, and 20 minutes is pretty much a good marginal effect for the average person. You can go up to 30 minutes, but anything more than that, then you're getting close to what they call accommodation of tissues, which means the benefits then will start to drop off. This is based on the Arnold-Schultz law. It's graphed out where and they maximize at a certain time energy density or energy delivery, and after you reach that apex, well, then slowly the benefits will start to go down. So overdoing it with light therapy is pretty much you're just wasting your time at that point. So it's best to just give it a session and then let the body take the energy and distribute it, and its own innate wisdom will figure out what to do with it and how to bring things back to health.
So the 6-pad system, and I would love it if you could talk about the protocol where the 6 pads are placed, and then also where the 3 pads would be placed. And I'll tell you a little bit in a minute about the miracle that I experienced from this that I didn't even expect. But so these are the 6 pads. I'm going to reset this. Tell me what the 6 pads and where you would place them to start off for a balance protocol, and what does the balance protocol do?
Well, the balance protocol I like to start everyone with, because I find that in my experience, all disease per se, and when I say disease, I'm not talking about from a Western perspective. To me, disease is let's define health first and foremost. Health is ease of flow of energy throughout the body. Hence, this is where the word dis-ease came from. When we don't have proper flow, energy-wise, throughout the body, well, then physiologically it's going to show up in things such as a reduction in lymphatic drainage in an area, a reduction in blood flow entering or leaving the area, and also neurological communication into the area as well as from the area back to the brain. So light therapy really helps to support this whole mechanism to clear things and get that flow reestablished. And so then the body just undoes these things. So with the balance protocol, what I find is we've all heard the phrase 95% of disease is caused by stress. So, and this was actually, I believe, I can't remember actually at the top of my head which university was that came out with this, but they actually are directed when we're stressed. This disease. Well, what I've found through working with biofeedback is that always the jaw was a problem with these people when any type of state of disease and or their dental health. So by working these key lymph nodes, we're helping to reestablish blood flow into and out of the brain through the carotid arteries, as well as the jugular veins to drain, and the lymphatic system there. Also, right in the chest, we're also targeting the points just below the collarbone. So I always tell people just take 2 fingers, start at the tip of the collarbone, and start working underneath the collarbone, and you get about 1 inch to 1.5 inches over, and it'll be, ouch, it's kind of tender there.
Right.
But we're addressing the key lymph nodes underneath where the smile lines terminate, back here at the angle of the jaw by wrapping here. We have the 2 points in the front of the chest.
Wow.
We have 2 points over the back. And if you feel around in there, just in beside your shoulder blade, you'll be able to feel on one side it'll always be worse than the other. Because, as I mentioned, the occlusion is how the brain sets the posture and the muscular contraction to keep you standing upright. And so you'll see it in someone's face where one eye is actually more open, and that's the side that's usually indicating more muscular contraction or a sympathetic dominance. The shoulder will be high on that side, and so will the hip. So what occurs with that imbalance is when the contraction occurs here more on one side than the other, it will actually cause C1 and C2 to compensate. And this sets up the rest of the spine for subluxations and a mild scoliosis to accelerated condition, which then puts direct pressure on the neurological points, which are supplying the organs as well as the glands. So, and then the posture has to modify, because when the head goes forward, the brain doesn't like to feel that. So when it goes forward, this causes, just so you don't fall over, the pelvis to either rotate excessively forward or even pitch directly forward, giving you a lordosis type condition. So the lower points are in close to the groin, called the inguinal lymph nodes, and then we also put that directly on top of the glute muscles, and we target that to help relax that muscle and get better drainage. So I use this first on these.
And it could actually help regrow the thyroid gland?
Well, we can't say that it's doing that, but what people do experience is a normalization of function. So we kind of figure that something's going on there, and otherwise it wouldn't go back to its normal state of functioning. So.
Interesting. Well, what it could do is it could cause, we do know that it would cause circulation to increase in the general area, right?
I've worked with a lot of people with knee injuries where they've actually been scoped. It's considered, based on the doctor's diagnosis, bone on bone. They decided to start using the light therapy, and in 3 to 8 months time, depending on the person, because everyone's different, they were able to incur full regeneration.
So that's another question, is how long does it take to get results? For me, it's an ongoing process for me. I got the specific results in 3 days from the sweating issue, and the TMJ worked automatically for me. I'm still working on the hip issue, so that could take, several months or however long it takes. But I love the benefits overall, because I just believe that that my lymph nodes are constantly getting a lymphatic drain, which is great for getting rid of toxins, because they do such a great job of catching them. Giving them a chance to actually detoxify is also great.
Yes. It's all about working with that lymphatic system, helping the body to maintain, taking out the garbage, as I call it. And the lights really help support, because it doesn't just create vasodilation in the blood vessels, it also does it directly in the lymph vessels. So this is how you can kind of expedite and keep that moving. It helps to also keep the proteins from sticking in an area and your free radical count going up, what have you. It keeps things circulating and flowing.
Okay, great. Go ahead. Someone asks, when is the best time I'm sorry, someone asked, when is the best time to use my light therapy device?
Best time? Now.
No, I mean morning, night.
Yeah. Well, it all depends on what's most convenient for the person. Putting it on in the morning, like if you want to kind of give yourself a bit of a boost in energy. I don't usually suggest that people do it just before bed, unless of course you're putting it on certain locations to help the body to relax as much as possible. A lot of people put this on, and usually they're asleep within a few minutes, and they wake up probably later on and take the system off, but it shuts off by itself, so you don't have to worry about it.
Yes. Okay, so I want to mention that there's an information page that people can go to, and it's theawareshow.com/light. And the website again is theawareshow.com/light. And there you can enter in your name and your phone number and an email, and you will be contacted about the light therapy and all of your questions. We're going to continue to answer more questions here. You will also receive a PDF document that talks all about the details of how and why light therapy works. A very well detailed paper about nitric oxide and mitochondria and ATP stimulation within the cells, so it's a very detailed PDF about why light therapy works. So people are asking mostly about the cost. What are the costs of the unit?
I primarily don't deal a lot with the cost, but although I do know that the system can range from, I believe, $1,500, depending on which system, up to $5,000. And of course, you can customize a package, so the price doesn't necessarily end there if you want to go. They have specific packages that they've already put together, but as I mentioned, they can directly customize a package for.
Okay, that's the whole point of the opt-in page. There is that it's best to speak with somebody about it, what would work best for you, what your needs are. So make sure that you include your phone number so that they can do a phone consultation with you to discover what your needs might be and what would be the best option for you to use. So once again, the website is theawareshow.com/light. You can also call a number which is 877-896-5025, 877-896-5025, and that's also a way to absolutely get a hold of somebody and talk to somebody directly about it. Okay, so are there any side effects of the light therapy?
Besides usually feeling better and getting better, there is the possibility if somebody has a lot of toxicity in the area, or they've got a chronic degenerative condition, as they back through some of they can back through some of their symptoms, which may have an increase in pain temporarily. But what I've always said to the people that I've worked with, just continue with it. It'll go away, and keep applying the lights, because it creates a cascading and systemic response as you continue to use it. So every once in a while they'll get what they call a healing crisis or a Herxheimer reaction, but that's like less than 5% of the population who experiences that. And so a lot of cases you're looking at they need to hydrate to help the body to flush the stuff out that they're eliciting, getting pushed back from the tissues back into the bloodstream to be cleared out.
Okay, and then many people are asking about pets, and this is very interesting because this was originally used on the horse community. Can you talk about how these light therapy pads can be used with animals and pets?
Pretty much the same thing. If they've got a wound or something like that, you can apply it directly. What I find with most pets, like dogs, cats, what have you, they usually require obviously a lot less than 20 minutes. You're only looking at putting it on anywhere from 3 to 10 minutes, depending on the size of the pet. So, but it works very effective. In fact, it probably works better on animals than it does people, due to the fact that when animals are injured, they don't walk around stressing out, going, "Oh, how am I going to pay my mortgage?" or "How am I going to go to work?"
Or go back and exercise it. Yes. Yes. Yes.
Exactly. So.
That's interesting. Yeah, that's one of the main problems, is getting someone to stay off their injury. We do tend to push through those. Which is a really great awareness, by the way, because it really helps in healing if you can stay off of it for a little bit. But again, all of this information, get the PDF, bring the information to your doctor, do your own research. I highly encourage that always, to listen to your own truth around something. However, the healing benefits are very, very well documented. Well, the benefits of how this light therapy has helped with various issues in myself, in Wes, and the people that Wes has used it on as well. So once again, I'm going to give you the information. The website is theawareshow.com/light. And the phone number, again, is 877-896-5025. That's 877-896-5025. You'll find the number also on the screen here. And what other questions do people ask you the most, Wes? I think I've gotten through the 10 questions, the top 10 questions here. Cost and specific pads, where do you put them in the body? But what about you? Do you have specific questions that people ask you most commonly?
Well, the most common question, of course, is once they understand how the light works with the body, it's the same question that you've asked me, and that is, how many times do I need to put this on before I'm going to see results? And I've always say to them, it's like, I have no idea how long it's going to take. In fact, I've been wrong more than I've been right, usually in a good way, because they're usually getting results much sooner than I predicted. And so it's really based on how healthy the person is, what kind of lifestyle that they maintain. This as it's playing. We're working from a holistic perspective and helping us to benefit and support the body. So the innate wisdom is going to undo these things all in its own time, and no one can predict that. So that is the primary question I always get asked, because of course people, once they understand the mechanisms of how it works and the simplicity of it, they're going, okay, well, I just want to try this thing and get going with it. So, but that's the #1 question I always get asked. So.
Well, I like to see when I speak with people, it's like we had a house guest who had psoriasis of the hands, and his hands were bloody, and so I've invited him. Look, try it out. He's in the middle of doing that, so I want to see if at the end of at least 3 days there's a measurable limit. I love really seeing if it can make a difference in people. A neighbor had severe TMJ, and she had tried everything, much short of Botox injections in order to release the muscle or something that she was going to do. So she tried therapy and had instant results, and that she hadn't had on anything that she tried. So TMJ I've personally experienced, and I've witnessed other people experiencing, and my own miraculous disappearance of these hot flashes, I tried nothing else. So I'm just excited about this therapy, and I want people to know and understand I'm all about choice. I'm all about representing the fact that you have choice in your healing journey, and that there are many choices out there, and you have to ultimately listen to your own truth and what works for you. But when I find something that has such effectiveness and that I had such a great experience with, now 2 different experiences, and I'm going for my 3rd, I want to share it with people. So go to the website to contact somebody and to get more information and speak with someone in person about your specific needs. There's a list of at least 10, probably hundreds and hundreds of people's ailments, and we can't get to all of them on the phone here. We've done a couple of shows about this, addressing many of them, and I think it's just best to speak with somebody. So go to the website, which is theawareshow.com/light, or the phone number, which is 877-896-5025. Thank you so much, Wes, for your time and your information, and I'm really grateful for having you share this entire light therapy revolution with us. Thank you.
Well, thank you very much for having me here today, and it's great.
Yep, we'll keep going. All right, thank you so much, Wes, and thank you very much for being a part of this show, and until next time, as always, I invite you to stay aware.